understanding the environmental triggers and having an action plan can greatly help those who suffer from asthma. Here to help from the City of St. Louis's Department of Health is public health nurse Eileen Webber. Welcome, Eileen.
Thank you for having me.
You're welcome. We're so glad you're here because this time of year, and probably all times of year, really, asthma is an issue, but maybe more so right now. So tell us about asthma. What does it feel like? When do people get it?
Absolutely. So in May every year, there's actually a National Asthma Awareness Month. Mm-hmm. So it's at this time that we and the CDC and the health departments really want to talk about education of asthma. Yeah. So because 1 in 15 Americans actually have asthma. So even if not personally affected, you're probably going to know a neighbor or a coworker or your child's friend may have asthma. So the more that we educate people, the more people can breathe well.
Yeah, and so is it possible that somebody may have asthma and not realize they have it?
Yes, it's definitely possible. Sometimes people may just have, shortness of breath, and they may be getting used to it, so they don't realize that they might actually have a problem. Yeah. So it's really important to follow up with your doctor if you're having that shortness of breath.
Yeah, to figure out where it's coming from.
Absolutely.
So is asthma something that typically starts in childhood and gets worse as you get older, or does it onset sometimes as an adult?
Yes, asthma does oftentimes start in children. Sometimes it's hard to diagnose before the age of 5, but usually, doctors diagnose a little bit more after that because people are having those symptoms for a longer time. And yes, it can also be diagnosed in adults as well. Sometimes they didn't realize they've had it for a while, and then they might be exposed to something in the environment that makes it difficult for them to breathe, and then they come to discover that they have asthma.
Okay, so environmental issues that trigger asthma. So talk about that.
Absolutely. So we call asthma triggers things in the environment that lead to these asthma attacks and can lead to these poor asthma exacerbations where people are really struggling to breathe. So some of those right now might be seasonal allergies with the trees and the plants growing. People sometimes complain of that shortness of breath. Also, cigarette smoke is a big issue with asthma, and it's very important that people that do have asthma are not around people that smoke. And some other things include like air pollution and exercise-induced asthma. A lot of people have heard of that as well. And things like mold and strong smells. Sometimes people may complain about the breathing around strong scents. So like the cleaning supplies that might be used at work or at school cause asthma sometimes.
So what can you do about that? Because you can't, if you're working and there's a cleaning smell and you can't extricate yourself from that. I mean, what are some of the things? And then exercise-induced asthma, what do you do about that?
Absolutely. So we hope if you do find out what your triggers are, we do want you to avoid them as much as possible. So, if you find out that cigarette smoke is something that causes your asthma, you want to avoid someone that's smoking at all times and don't go to those places. Or sometimes if you have asthma in your home or the triggers in your home that are flaring up your asthma, we would want to help to clear those out of your home. Like if you have mold in your home, we would want to clean that out so that that's not bothering you. Another one I forgot to mention is pets. Yeah. So sometimes people are allergic to their cat or their dog, and so it's important to avoid those.
Fido.
Unfortunately, yes.
Oh, that's sad. But I agree. It's important to identify where that's coming from. We're going to take a quick break and come back to learn much more about asthma with Eileen after this. Please stay with us for more STL Live.